Welcome to the Well Mind Podcast, a space for meaningful conversations about a broad range of wellness-related topics, with a special emphasis on our mental health. I'm your host, Dr. Ben Kohls. I am a clinical mental health counselor and counselor educator here at Bethany Lutheran College. I've really been enjoying sharing these conversations during Season 2 with you, getting to know our faculty, getting to hear about their training, their personal and professional experiences, and diving a bit into their areas of expertise. Today's no different. Dr. Joshua Mears comes back on the podcast. He is a friend and colleague and supporter of the counseling program in many, many ways. And so we pick up some of the threads that were present in our first conversation on the podcast. A lot of that focused on faith integration in clinical practice, and we certainly talk about that today. But Dr. Mears also shares about his formative experiences in the field and really what drew him to both clinical practice and teaching. So Dr. Mears has a background working in corrections as a clinical psychologist. He continues to do some of that work now, even as he owns his own private practice. But a lot of his work is focused on supervision and really mentoring our future clinicians. So all of our conversation today revolves around some of those key themes. We explore some of the challenges and rewards of his work within corrections. We also talk about the significance of spiritual care in mental health therapy and examine the concept of transcendence in the face of suffering. Dr. Mears certainly shares insights from his experiences and emphasizes the need for a grounded approach to mental health care that both honors professional and personal values. So here is my conversation with Dr. Joshua Mears on the Well Mind Podcast. Welcome to the Well Mind Podcast. Today I have Dr. Joshua Mears joining me. It's a real joy to have you on the podcast, sir. Thanks for coming.
Absolutely. Such a blessing to join with you and have another conversation, Dr. Kohls. It's always good to reconnect with you.
Yeah. I lament that we just don't get as many opportunities as I'd like to be able to spend that time together, to be able to chat, personally, professionally. So I'm thankful that we could schedule this.
Absolutely, yeah. It
would be to sit down together.
It would be a better thing in many ways if I had more time and more Dr. Kohls in my life. Because yes, I miss you, brother. This is good. Mm-hmm.
Yeah. Well, I know you had messaged Bethany had the gala. Maybe it was a couple of weeks ago now or something. Whether or not I was going, and I was just tapped. I've been stretched over the past few weeks with stuff. So yeah, couldn't make that happen.
So rude that you weren't able to join. Yes, would have loved to had a chance to spend the evening with you, but
yeah, that would have been good.
It was a good evening, and yeah, you were missed. But
yeah. Well, this is your second time on the podcast, but it has been a while. We were just chatting before I hit the record button, and I think you were early on in Well Mind history in terms of its lifespan, but I recall that conversation fondly, even though I think we were bantering a bit about some Vikings and Packers things. Which, not to,
that still
not to
exists.
Bring that up. Yeah, not to bring that up right off the bat here, but I don't know. Do you have any predictions for next season for the Vikings? Or is it too early?
I predict that the flirting with Aaron Rodgers has to stop. I hope that we are moving on from the idea of taking Green Bay Packers quarterbacks and trying to make them into glory again. So I think the Vikings are in a good position. So I like where we're at and excited for the year ahead. But
Cool. Yeah, I don't know that that's going to go anywhere, nor should it. But that would be second go around for you guys in recent memory, at least.
Right. Yeah. We don't want to. I don't think we want to relive that heartbreak in a different way. But
good. Well, I've been starting off these conversations with some discussion and description about what sparked your interest in the field of mental health, of for you as a licensed psychologist, working in that sister discipline from mental health counseling. And I definitely want to hear about that, but I think it's also relevant to just lay out a little bit of the map in terms of how you have been and continue to be plugged in and connected with the clinical mental health counseling program here at Bethany. And I think that, Dr. Lundgren and I talked about that when we chatted,
Mm-hmm.
because her and I we worked closely on the feasibility study together in terms of like curriculum proposal and development and things like that. But honestly, it was you that reached out to me in the very first place to even make me aware of the fact that Bethany was contemplating a graduate program. So that goes way back in history now. It
It
feels like
does. It does.
almost a different, just a different, whole different chapter of life.
It does. Yeah. And it is, it's kind of a beautiful thing to marvel at, kind of how God's hand is involved in kind of these endeavors and has blessed the program. And yeah, those conversations that we had early on, and I was very proud to be part of that feasibility study too, as the co-chair of that, and exploring that when Bethany was looking at graduate programs and the first program that Bethany would have. And um, pretty natural fits to have that conversation with you, and kind of your experience in clinical mental health counseling and in your doc program. So, I mean, it is super exciting to just see. I remember those conversations and those committee meetings and
Yeah.
exploring kind of the different graduate programs and what we were examining and the risks and benefits of Bethany starting this. And just super beautiful to see how God is using Bethany as an institution and using its students to help provide God-fearing Christian counseling to those out in the field now. So
Yeah. 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 That was, it was such a fun, like interesting experience for me to be able to think at that point about, creating something, with like-minded, Christian, professionals that would, really be serving, a tremendous need, honestly. I
mm-hmm,
mean, mental health services, there's such a need for those across the board, but to be thinking about this, like from a Christian worldview, being able to train professionals with that mindset in terms of their clinical identity, but then also thinking through what that looks like in clinical practice. So that was hugely interesting, and obviously, the trajectory of that has played out as it has. But you continue to be involved in not just being an advocate and a support for our program out in the larger community, but also as an adjunct instructor in our program. There's an elective
mm-hmm,
that you teach for us in human sexuality that's offered pretty much every summer since we started things. That has been a really important course for us to host. But then you've also been a clinical site for a lot of our practicum and internship students as well. So that connection really on the front end in terms of its inception and conceptual groundwork that was laid, and then now being able to see students as they are coming out into their first clinical experience, and you, whether that's been you providing supervision or clinicians within your practice providing supervision. Yeah, I'm curious a little bit about what that experience has been like to
mm-hmm.
you, for you to really be on these like bookends of
Yeah,
of the program here.
yeah, completely. And going back to even in kind of some of those original committee meetings, I remember Dr. Kohls, like we did some of that market analysis of what the need was. We surveyed some constituents about kind of their potential enlistment and enrollment in a program. I think you can probably remember some of those committee meetings. I was like, the results are in. What are we even thinking about? We should just move forward. Let's go.
Yeah.
And I
Yeah.
think you uh, and now as the director have kind of embodied that, like, patient, make sure that we are establishing a program that is really well grounded with the right faculty, with the right
Mm.
programmatic kind of vision. I was just ready to go. Let's do
Yeah.
this as quick as possible. And you are much more of the wise patient planner. But in the same way, like, yeah, to fast forward to now that I really do get to see and in many ways reap the benefits of the program and the students that we have had over the last couple of years at the Souls Apothecary, which is the outpatient private practice clinic that started a couple of years ago, and the opportunity to work with students that just really understand that conceptually what good clinical evidence-based mental health care that can be grounded in and strongly rooted in Christian integration, how much of a need there is for that. And these students have just been an amazing blessing to work with. And we are so thankful that we've had kind of the students that we've had that have been able to do kind of exactly what we're trying to do in the mental health field in the clinic here. And the as an adjunct faculty, the specific program in human sexuality, it is again, it's a wonderful blessing to be able to teach in that course, to be able to give some of the clinical insights and experiences that I've had with working with and engaging with clients that are sorting through the many social and cultural issues of sexuality and gender, and the onslaught of challenges that the world is presenting as far as kind of how to be able to navigate those things, and as they intersect with faith, as they intersect with conflicts within family systems and worldview clashes.
Yeah.
And
Yeah.
these are really, really complex conversations and clinical scenarios that have torn families apart, and that to be kind of right at the center of trying to be able to provide assessment and therapy that really helps clients sort through difficult, really nuanced challenges is a real blessing, and helps me clinically, and helps me to be able to do kind of the frontline work that I'm doing with many families. So
Yeah.
it's been a blessing to be in that adjunct role as well.
For sure. And that's just one of the things that I'm so grateful about, being able to bring in adjuncts like yourself and a lot of your other colleagues in the field, like, because you have such rich clinical training and experience that you can bring directly into our virtual classroom for students to be able to not just approach it from an academic sense of like, okay, this is information that I need to know, but really providing the breadth and depth clinically on how this looks for people that you're serving. And that, yeah, that's always been a joy that I had prior to this program, and in being able to be an adjunct, is like, okay, this is an area that I really specialize in, or spend a lot of time with, and we can do that in the classroom in a really focused way. So I just, yeah, I'm so appreciative of having folks like you and our other adjuncts to be able to bring that level of expertise into their training process.
Yeah, it like I mentioned, it is definitely mutually beneficial. It definitely hones my clinical skills in a very important way, and I yeah, love to be able to interact with the students and to be in the research and thinking through again what is the best care for these souls that need support.
Yeah, yeah. So that's maybe a good then point of circling back to kind of where this all began for you. Like, what was it about this field, or even about this topic related to the psychosexual evaluations that you do? Yeah, just what was the spark or the draw for you to bring you into this field, and then furthermore into this specialty area?
Sure, sure. So I think like the origin of kind of getting into the mental health field in general, I come probably always from a very young age, knew that I wanted to be a helper, wanted to be someone that could walk alongside people. Probably thought that my path might have ended up in a ministry or a pastoral role. And then I learned about Greek and Hebrew and realized that the languages, or not
Yeah.
necessarily something that I was gifted in,
I feel
and
that. I feel
yeah,
that.
absolutely. Um, and during undergraduate time at Bethany, really blessed with the now sainted and departed Professor Weekman, just who really opened up the field of psychology to me, and the questions and exploration of the human mind and kind of why people do what they do. And his classes, I just remember still some of my favorite moments as I was developing as a young adult Christian man, to think about these kind of deep questions of philosophy and meaning and life, and just the sense of humor that he brought, and
Sure. Yeah.
the nature that really did kind of help define that this is something that I was really intrigued by, and wanted to explore further. And as I was thinking about that even more in kind of consideration of this conversation today, I do remember that it was probably even a different landscape altogether than where we're at right now, because I remember conversations with my parents, who are very God-fearing, both of them Christian day school teachers, but maybe being a little leery about this field of psychology.
Sure.
And I probably growing up in an era that they did, where counseling was mostly held and kind of taken up by the local congregation and the local pastor, the shepherd of souls in that way.
Yeah.
So I think
Yeah.
they even were like a little hesitant about, well, what does this mean, and what kind of field of study or discipline is he even going into? Which I think there's some of that, and that's what the Bethany program and this integration of the faith is all about. Is kind of, how does that, doesn't um, say that if someone is struggling with mental health challenges or difficulties, that they have a lack of faith, and it is
Mm,
really how these two areas complement and work together that really defines really great Christian integration. But I think
for sure.
I was kind of probably studying on the front end of that, at least on a personal level, that I probably had some background in history where um, family didn't really kind of have as much of a positive view of what mental
Hmm.
health field could bring to the Christian realm, which probably led me into really wanting some of my graduate studies to explore that intersection of faith, even at a more in-depth level. So I was originally applied for and got into the doctoral program that I eventually graduated from. However, in between, I took a 2-year kind of detour and did a Christian counseling master's program up at Bethel.
Okay.
So even though I was admitted right away out of undergraduate into this ID program, I wanted to have more time to be able to really study what does Christian counseling and integration
Yeah.
principles mean, and how does that help
Hmm.
me in my kind of vision of what I want to be as a helper.
Yeah.
So some of that kind of shed its way into the clinical training, the internships, and the opportunities that I had along the way. Um, got really heavily involved in correctional psychology. So a couple
Hmm.
of different opportunities where I worked in juvenile jails,
Yep.
juvenile correctional day treatment programs, and
Yep.
then eventually in the adult maximum security prison. And each of those times, I think I was drawn to working in the correctional, or kind of in incarcerated facilities,
Hmm.
um, because I think it really sheds like that. This is people at some of their most vulnerable moments, when their difficulties, their trials, their own behavior had led them into some pretty significant consequences. Um, and I think I wanted to be able to understand not only how they got there, but kind of what meaning making and kind of purpose they're drawing out of even those dark trials that they were in,
Hmm.
which led to a lot more exploration of kind of some of the history of whether it's violence or sexual assault. Kind of when you're training in a correctional psychology field, you're getting a lot of exposure to kind of those developmental histories of kind of where some of those acting out behaviors have come from.
Yeah.
Um, which I've definitely carried over into now my role as a psychologist, where I do a lot of that psychological testing and assessment, and still stay pretty busy and involved on that forensic psychology evaluation piece, where I'm still going into the jail once a month, so
Okay.
still
Okay.
getting that opportunity.
Yeah, that was something that I wasn't sure about, if you were still doing a
hmm
lot of those, yeah, uh, whether they're incarcerated or justice involved individuals, how much of that work from an evaluation standpoint you were still doing.
Yeah, I'm still in and out of jails every month, so my mom is so proud of me that my adult life is spent.
Little correctional hero
Thankfully,
there.
yep. Thankfully, they let me out every time. But
Yeah, that's good. That's good. Yeah, so a lot of this emerged from just the training experiences that you were having. I wonder, did you, when you were identifying, clinical early those early clinical experiences like internships and things like that, were you seeking out to do things within corrections and the justice system, or was that just kind of the opportunity that was presented to you?
I think I was pretty intentional about that. I did. I think again, the part of the reason why I was drawn to this field is that I think that the Christian worldview encourages us to be the light to the world and to be able to seek and save, and encourage those that are lost. And I see that as a wonderful blessing to be able to be called and help those that are in their darkest kind of experiences. So I think I was pretty intentional about, like,
Yeah.
yeah, that this provides a very unique opportunity where people are going to be, um, in many ways they're forced. They are a lot of times court mandated to meet with me, or they
Yeah.
were
Yep.
court involved. But it's still during those dark difficulties and trials that they can be really open and raw about their life experiences and their history. So I was, yeah, very intentional about applying for the correctional and prison route of my training.
Yeah, I just ask because I think sometimes we have an idea in our mind as we are either entering into to school or training, where maybe we have an outcome that we're driving toward,
hmm
and other times maybe that's a little bit fuzzier or something like that. But uh, and then other times it's like, well, I'm just open. As long as I stay open to different experiences, that's where I'm going to be able to learn and gain some insight and grow personally and professionally. um, because when I think about my early experiences in the field, being in residential care, a number of the youth that we were serving had been justice involved or were, um,
hmm
and were kind of mandated for some kind of treatment, and the families were saying, okay, well, we want to select where our child goes. We want to elect to be able to have them go to a facility that will support them in their behavioral health, their mental health development, but also in their
hmm
spiritual care, which obviously many times people don't have that choice, but
hmm
with youth being able to have different diversion type programs and options that way to be able to participate in other programming, sometimes that's yeah, useful. But that wasn't something that I was seeking out. That was just something that
hmm
was the door kind of opened for me, and I said, "Oh, okay, yeah, I do want to work with youth. This seems like a good fit. It's a Christian integrated program." But then, that stayed with me for a while, where I was working with justice involved youth and community based programming through the county, through a nonprofit organization. So I spent lots of years doing that, but that was not something that I
hmm
would have selected, self selected for. It felt more like that was the opportunity that was uh, chosen for me in many ways.
Well, I'd like to, yeah, say that I've prescribed everything and it's all as I envisioned as far as my career. There's things about it that were certainly very intentional and purposeful, and kind of who I wanted to really craft as my identity professionally. But there's certainly, yeah, continues to be God's handiwork in a lot of kind of directions and some of the leanings and
Yeah.
some of the some of the beautiful experiences that I've had within the correctional lens. And that's one of the things that, it's, I worked in the county and state system, and it's very highly, not faith informed. It's a
Hmm.
secular program run by the state or the county, but there's so many client experiences, so many clinical kind of that still kind of revealed important and valuable, I think, Christian worldview aspects that, whether it's assessment or therapy, that I could, as a Christian provider, I could still see God working through me and kind of through the clients, even if that wasn't directly and explicit integration necessarily.
Yeah, yeah. So, I mean, a couple of things that you're speaking to here that stand out to me. One, um, there's this implicitness to just bringing yourself
Mm-hmm.
into your role as a professional helper. That you can't really separate who you are as a person from who you are as a professional. And so, because so many of your uh, like pathways, decisions,
Mm-hmm.
directional choices are based largely in a core set of values that are from your Christian faith. Like, you're bringing that with you, right?
Mm-hmm.
But when you're working for the state, you're working for the county. These are settings where uh, a level of implicit integration is about as far as you can go in terms of what you're bringing. Now, I got to think you're also eliciting from the client what
Mm-hmm.
their, not just what their childhood experiences are or what their decision making is like, but also their religious and spiritual beliefs and perspectives, and how that
Mm-hmm.
intersects with their lived experience as well. Um, so that's like one piece that really seems to come through loud and clear for you, is like you're pretty congruent no matter what the setting is. And but now you've chosen to be in a setting
Mm-hmm.
by starting your own practice, the Soul's Apothecary, like that is a highly explicitly integrative identity as a clinic. So
Mm-hmm.
that I don't know. I don't know that there's a question there. It's more of
Yeah.
just reflecting on what you've been laying out here.
Yeah. And I think an account or a story that kind of draws that some of that out. I remember specifically when I was done with my doctoral program, I think I was having a lunch with some of the social workers and the correction officers, and I told them that I wanted to work in an outpatient Christian organization. And I think they were just dumbfounded because they didn't really see or even know that that was as important to me and my values and kind of how I was going to mark my professional identity. And it kind of felt like a little bit more of a here I stand moment, that
Mm.
this is who I have been trained alongside and know and appreciate how to provide really solid evidence-based mental health interventions. And I think I can do this also where clients are going to want to have that deeper exploration of kind of their spirituality and their faith, and how that is an important kind of meaning and intervention in their lives. And I think that was really just helpful, in some of the work that I did early on in my career. And now what I'm doing here at the Souls Apothecary, where that's absolutely what I wanted to establish as far as the private practice. And when this organization got started, is that I wanted to be able to be known in the community as a group of providers that is really strong as far as providing everything that you could get at any outpatient mental health clinic, and strong certification, strong training in some of the best mental health care that there is. And one thing that I do think that helps us to stand out is that for folks that want to have that Christ-centered integrated care, that we are very strongly rooted and trained in how to bring that spirituality and faith as an important dynamic into their care. So that was the real impetus of starting the Souls Apothecary, was to be able to do that. And I think as at a turning point in my career, where I really wanted to still be on the front lines of providing that care, not just as the clinical director, not just as a supervisor, but I felt, and I still feel, very compelled about the idea of being a resource myself directly and providing that direct clinical care, and wanting to have as much opportunity to be able to help clients directly in that counseling room. And that I've been very blessed over the last couple of years to be able to have that opportunity.
Mm-hmm. Mm-hmm. Yeah. Yeah. That's, there's such a parallel in how I think about training our counselors as they're moving through their programming with us too. And that, in terms of accreditation, approval for, license eligibility, preparation for national examinations, like all of these benchmarks and standards
Mm-hmm.
within our larger profession, like that we would really stand out as a program in each of those areas. And then just like what you're talking about, the students that want a space to be able to think through what God's word has to say about whatever topic we're studying, or where they might feel like challenged within their own faith formation with the different topics that are being addressed, like just creating a really meaningful and honest space to be able to sort through those, and then build on that as we think about excellence in faith integration too. I was just at CAPS, the Christian Association for Psychological Studies conference, a couple of weeks ago, and had the privilege of being on a panel with two other faculty at faith integrated, CACREP accredited counselor ed programs in clinical mental health. And the three of us talking through the different approaches that each of our programs are taking to that element of faith integrated training. And still there isn't like there isn't a manual anybody has that's saying
Mm-hmm.
this is the one way to do it, this is the best way, so there's still a lot of thoughtful discussion around that.
And
But
that's the beauty of it, right? That
yeah.
the conversation, the dialogue never ends. That this is, yeah, it's not going to ever be formulaic and prescribed. That this is individual, and there's certain truths, there's principles and foundations, and the rock of the foundation that we have in God's word and what He has done and how He has shaped our identity. Those things are transcendent, and they do help us to be able to understand who we are and who our clients are, how God is, in the shape that He is placing in our lives. But that's an ongoing conversation. It's a beautiful one to be a part of regularly.
Yeah.
Yeah.
Yeah. And then I think that I mean, that plays out in the therapy room too, right? Like as you are meeting with an individual struggling with whatever mental health concern that they're also having those intersections with their own faith formation too, and feeling challenged
Mm-hmm.
in that way. And I wonder if you could illuminate in any kind of an illustration or an example of what does that tangibly looked like in some of your work with clients that you're serving, when you're thinking through what are their mental health needs, and also walking with them in whatever spiritual struggles or season they might be in as a result of or connected with their mental health.
For sure. So yeah, I'll do my best, as any good clinician is, especially in a public format like this, to try to be very intentional and vague, descriptive, won't give specific details about a
Of
client
course.
information.
Yes.
Um,
Yeah, for sure.
but for example, a client that is struggling with, maybe chronic pain, chronic challenges with just not being able to be functional as much as they want, and feeling like they're never getting kind of any of the answers medically, which is leading to kind of like severe and debilitating depression and anxiety. And I think a lot of the times that conversation, we can talk about, cognitive behavioral strategies and trying to improve kind of their functionality and improve their exercise and improve their ability to recognize disruptive thoughts. But a lot of times that conversation also comes down to kind of their core meaning and their purpose, and how is explicitly kind of even their creator or God involved directly in the layers of suffering that they're experiencing. So we'll talk in the session directly about kind of what does that mean to be able to explore that you're crying out, to God. You're hoping for mercy. You're hoping for relief from this pain or this suffering. And what if it doesn't completely get eliminated? What if your life, and you wake up the next day and the day after that, and it still feels like um, there is no change, there's no hope, there's nothing that is working? And that tension of living in this reality where pain and suffering continues to exist, and how does that contradict what would we might believe as far as who God is, if he really is all loving and truly all powerful and present in our lives? It feels like a contradiction. So we talk a lot about kind of what do you do with that paradox, and kind of that experience that feels like you have been abandoned or rejected. And really, what does that mean to have a true connection and attachment with the divine when it feels like there is no one there? And in reality, God's word and his presence do remain. And how can suffering be able to help you to bear across in a much different way, to be able to understand where your purpose may transcend, the day-to-day life here, and to look to things eternal, and to look to where um, crying out to God and lamenting is a beautiful thing, and how he can redeem, and not just to redeem and make things right here, because we're all still like earthly beings, and we want to have that survival story where we have post-traumatic growth, and we're therefore actualized with. But sometimes that pain and suffering remain, and still just sitting in that still quiet presence of God, where he is saying and reminding us that he's not departing from you at any moment.
Mm-hmm. Mm-hmm. Really beautifully said. And I think that does it illuminates the struggle, because it comes back to purpose, it comes back to hope, and and when we are faced with, especially a chronic and persistent thing that there isn't relief for,
Hmm.
in the short term, or potentially even in the long term. It's like there there are huge spiritual struggles that are underneath and oftentimes emerge from that, and having a space to be able to wrestle with that, in light of the truths of God's word,
Hmm.
um, is you use the word transcend, and
Hmm.
that's a word that's actually come up for me recently on a number of just very distinct occasions, completely different conversations, but this idea of transcendence uh, has just it's resurfaced for me time and time again over the past month, and so here it is again,
Hmm.
and so I wonder, within the with facing the pains, the suffering, the struggles, um, yeah, I I'm getting to the point where it's like, okay, what does transcendence mean in that experience? And of course, people are probably thinking like, well, how? I want to know
Hmm.
the how to transcend.
Hmm.
But I think starting with a what that is first is probably best.
Yeah, and that to me, it just speaks to the reality of how much of a true blessing and an honor it is that I get to meet with people, to be able to see them walking through these trials, to be able to see things like hope and peace that
Yeah.
aren't quantifiable, and our minds can't really appreciate or define in a
Yeah.
logical kind of even necessarily verbal way, but that
Mm-hmm.
there is God's presence in their lives. And that to be a witness of that, of
Mm.
the work that the one true wonderful counselor is doing. And if that's not me, that's Christ himself
Yeah.
working in the lives of people. And I get to be a witness to that regularly, of how he is providing comfort and hope to them. That is what I think is transcendent, is to be able to see the true beauty and good that comes through even in darkness and in trials.
Yeah. Yeah. That it brings me back to that peace that surpasses all understanding,
Mm-hmm.
right? The peace transcends our ability to logically grasp that, and that's, yeah, incredibly special and like you said, meaningful to be able to walk alongside somebody as they're wrestling with these things and recognizing that or experiencing that simultaneously while still facing the reality of this world.
Absolutely. Absolutely.
So, as you have been, continuing to build this practice, to build a team at the Souls Apothecary, and think about the future of the clinical services that you and your team are providing. I'm curious. Like, you're still, like you said, it's been a couple of years now,
Mm-hmm.
but where do you see things going from a future oriented standpoint, Josh?
Yeah. So it's interesting. I think again, during different eras, during different chapters of my professional career, I probably have been guided or encouraged or even envisioned like that. I want to do the most, have the most impact, to be able to bring what I think is very valuable counseling philosophy or care, the soul care approach that I think really is influential in people's lives. But I think at this time, and even in hopefully future chapters, I've really tried to I would say, have a limited view of kind of expansion, a limited view of not being overly grandiose as far as goal setting. I want to be present in exactly where my feet are and exactly what God can do with the day that is present right now. And
Mm-hmm.
so I think regularly about, I think Luther talked about that through the doctrine of vocation that God provides um, by the milkmaid that brings and cares for the cow, brings us our milk. And I think that same variation, I want to focus on milking my own cows. I, I don't want to have
Yeah.
a bigger vision or a grander idea of expansion. I really want the limits that God encourages us to have, the boundaries, expectations for myself personally, for the clinicians that work at the Souls Apothecary, to have a much and a very healthy view of how they care for themselves, of how they care for and tend to their vocations outside of the professional work, and to
Mm-hmm.
not be overly focused on doing things that aren't called for and asked to them, that really just focus on the work that's right in front of you.
Yeah. Yeah. And yeah, and I hear in that there's a presence that you're bringing to that, like as you talked about your feet being planted where they are and being focused on where you're at in this moment. And
Hmm.
um, yeah, there's because I think in this world, oftentimes the enticement of continued like expansion or growth or like that's a sign of impact or meaning, like somebody's doing
Hmm.
something good because it's continuing to grow and expand in a way. And what you're bringing a different perspective in that you're saying no, within the boundaries or the limits of the way things are presently, we can do things at a high level with a high level of excellence,
Hmm.
and focusing on that seems to be more where your mindset is at this point.
Yeah, and I think it's a beautiful thing to not let your own, yeah, visions or kind of premonitions of whatever accomplishments, and to just allow, yes, God and his handiwork, and allow,
Yeah,
you know
yeah,
honoring, to be home at dinner with my family, and to,
yeah,
the callings and stations of life that are throughout the day,
yeah,
be honored.
yeah, yeah. You got to milk your own cows.
Milk your own cows. Yes.
That's yeah, that's going to stick with me for sure. Maybe I'll even title the episode that. No, I probably won't do that. That
Mm-hmm.
might throw some people for a loop.
Yeah.
But if people are listening at this point, they're invested. So here's a takeaway
There you go.
is milk your own cows.
Yes.
Yeah. Well, it's been a real pleasure getting to have this conversation with you. Time goes by so quickly, and it just is signaling to me once again. Yeah, we gotta figure out a way of connecting on a regular basis outside of these kind of planned and structured things. That we got to make that happen. So whether it's me coming your direction or next time you're here at Bethany, we've got to grab some coffee or lunch or something like that.
Absolutely, and I agree. We have to make sure that this happens more frequently. So
awesome. Well, thanks so much for your contributions today to the Well Mind. Thank you for your contributions here at Bethany in our clinical mental health program. Thanks for your contributions within our larger professional community of helpers as you continue to provide excellent services, train great clinicians, provide supervision, and advance our field of faith-integrated care and counseling.
absolutely. God bless you and all the work that you're doing at Bethany as well.
One more big thanks to Dr. Joshua Mears. It's great to have him be a part of the Well Mind community through the podcast and be a faculty in the counseling program here at Bethany. Having him share his expertise within the classroom setting as well as in the training process for students that are in their internship and those that stay on with the Souls Apothecary after graduation. It's just a really rich mentoring experience that he's providing through his clinical practice. So I hope that you enjoyed our conversation and found some good takeaways or some insights that you're going to chew on. That's always my hope. Season 2 is almost done. Just a couple more conversations to come yet. So I'm looking forward to being able to record those and share them out with you in the coming weeks. Now, hit that like button, subscribe so you get the newest episodes in your podcast app. Give us a 5-star rating. That helps share the word about the Well Mind on the different platforms. But of course, word of mouth is the best. Gift this episode to somebody. Send them a link. Encourage them to give it a listen. And that'll really help grow the audience and our community as well. So thanks for spending your time with me today. I really appreciate it. And until next time, be well.